Hi, I'm Dr. Samantha. I'm a board-certified psychiatric nurse practitioner with over 13 years nursing experience, working in mother-baby postpartum, NICU, antepartum, and labor and delivery. I'm also an IBCLC, I'm perinatal mental health certified, and maternal newborn nursing certified. Sex is an important part of healthy relationships, but pregnancy sex can be scary for couples. Today is the third of a three-part series about sex during pregnancy, where we'll be telling you everything you need to know about sex during your third trimester of pregnancy and how to make it great. So click those like and subscribe buttons and stay with us. Your third trimester is 27 weeks to 40 weeks. This is a trimester where you may notice a drop in sexual activity. This is often because women become less comfortable and feel less attractive. Also, you have a big belly, which increases your difficulty with having sex. Now, one of the things you guys should know that's kind of fun is that sperm has prostaglandins in it. And these prostaglandins can help to soften and ripen your cervix, making it easier for you to go into labor. So I encourage you to have lots of sex. It's good for you and your partner. Now, one of the things that can happen during the third trimester is spotting or leaking of your breasts. Spotting is bleeding, and that's common because of the vaginal dryness that we talked about. Leaking breasts is because you're now starting to make colostrum for the baby. And finally, don't forget to pee before you have sex because you have that full bladder during your third trimester. During your third trimester, try to have sex whenever you feel like having sex. This may mean it might be different times of the day. You want to keep a towel handy or possibly wear a bra due to those leaky breasts. Make sure you're using lots of lubrication because your vagina is probably dry and irritated at this point. Water-soluble lubrication is best because it has less chemicals. Also, it's easier to wash off. You want to avoid using any warming products, flavorings, glycerin, fragrances, and parabens because they can cause infection and irritation. Many couples are concerned about safety during pregnancy. So sex is safe in a healthy, uncomplicated pregnancy. It does not lead to miscarriage or preterm birth. It promotes connection between the partners, and the hormones released during sex can help relieve pregnancy discomforts and ease stress. Anal sex is okay during pregnancy, but just remember, if you've had anal sex, you cannot re-enter the vagina without washing up first due to the increased risk of bacterial infection. Please remember to hit the like and subscribe buttons so you can get our latest content. Third trimester sex positions include what's commonly known as doggy style. This is a rear entry position, and usually you're on your hands and knees or you're kneeling, and your partner comes in from behind. This has a deeper penetration, which is often a lot more enjoyable for you. Now, the one thing you need to be careful of with doggy style is it may irritate carpal tunnel syndrome because you're putting pressure on your wrists. Spooning or sideways from behind is another popular position. This is where you lay on your side and make sure you put a pillow underneath your belly to support it. The partner penetrates from behind, allowing for a shallower penetration if that is more comfortable from you. You can also do sideways at an angle. So this is usually where you guys are facing each other, but your bodies create a V shape. And you're gonna go ahead and you're gonna rest your bodies on top of your partner. This allows your partner to take on most of your weight and keeps your partner's weight off of your belly. And finally, remember, you should no longer be laying on your back to have sex during the third trimester, as this can put pressure on your major blood vessels and be dangerous for both you and the baby. Here are some tips for having great sex during this trimester of your pregnancy. For starters, you can use sex pillows for positioning. You can also use your pregnancy pillow for the same thing. Vibrators and sex toys are safe during pregnancy, but try to use a higher quality material such as glass, silicone, or body-safe latex. Make sure that you're cleaning your toys well and use a lubrication that is safe for them. Finally, you want to check the settings on your toys because your clitoris becomes very sensitive during pregnancy and your normal settings may be too much. There are several reasons why you may not be able to have sex during pregnancy, and your healthcare provider should be letting you know some of these. For starters, if you're having any heavy bleeding or placental issues, including a placenta previa, which is where the placenta sits over the cervix. Also, if you have premature rupture of membranes, which means your water broke early, or if you're having any trouble with your cervix, like early dilation. If you're pregnant with multiples, like twins or triplets, you may not be able to have sex. Also, if you have any active sexually transmitted diseases or a history of preterm labor. Finally, if you're being told that you cannot have sex, it's very important that you also clarify whether you're allowed to have an orgasm. A lot of times you are allowed to have orgasms, which means you can masturbate. You're just not allowed to have vaginal penetration. I hope this video has helped you learn everything you need to know about great sex during your third trimester. Please share your comments and let us know what topics you would like to hear more about. Remember to hit the like and subscribe button so you can get our latest content in pregnancy, labor, and early childhood parenting. Share this video with your friends and family and follow us on Facebook, Instagram, and Twitter for additional content. We will link those in the description below. Thank you so much for joining us at the Maternity Mentor.